All right, let's talk about EPAs and milestones. Quickly going over the definitions. An entrustable professional activity. It's a unit of professional practice that can be entrusted to a sufficiently competent learner. It's a task or responsibility that we've deemed essential to our practice. Whereas a milestone is an observable marker of an individual's ability. Key difference between the two: EPAs are tasks or activities, whereas milestones are the abilities of that individual to be able to do that task or activity. You might see or hear an EPA being described as a basket in which it holds several different milestones. And reminder, there are 87 EPAs that are the same across the country for our specialty. Here is that article that I have attached in the email if you want to further understand the theory behind EPAs. A little disclaimer though, they don't use the word milestones. They're using competencies that's akin to what the Canadian Royal College has termed a milestone. It's only 5 pages. I recommend it if you have some time. This is a table from one of the authors of that article that shows what they call competencies or person descriptors. So a person's knowledge, skills, attitudes, values. But this is nice to make the distinction between what an EPA actually is. So it's describing work: discharge patient, counsel patient, resuscitate patient, essential units of our practice. We have 4 stages for residency training. First one, transition to discipline, has 4 EPAs. One of those are actually elective, that is recommended to take place over 2 blocks only, so 8 weeks. Next stage, foundations, is 27. Core, as the name suggests, has a lot, 44. And the last stage, transition to practice, has 12. I've decided to walk through the very first EPA. So transition to discipline, first stage, EPA number 1. These are screenshots of a Word document that I also attached in the email that's just describing this EPA and gives you instruction for what to assess and the milestones within that EPA. I'll have screenshots of it, so don't worry, you don't have to open the file up. So the very first EPA, performing preoperative assessments for ASA 1 or 2 patients who will be undergoing a minor scheduled surgical procedure. Our key task, preoperative assessments. Can the resident do this? We have some qualifiers, so it's going to only be for ASA 1 or 2 patients, minor surgery that's scheduled or elective. Remember, this is a transition of discipline, i.e. junior resident, so we're not going to go too hard right off the bat. Next part in that Word document, you'll see that there are 3 parts, A, B, and C, to this EPA. And we'll go through parts A and B. Keep in mind, you only need to do part A or B for this EPA. If you're feeling generous, you're in a good mood, you got a lot of time, you could do both A and B for the same resident, but it's not expected. So let's say it's the morning and your CBD resident asks you, can you assess me on this EPA part A? So here are the directions. It's part A is a direct observation. So that means you must be physically present while this resident is doing their preoperative assessment. Form 1, which I'll talk about in the next slide, asks you to collect information on the type of surgery as well as how old the patient is. This part is for the resident, just saying that they need to have 2 direct observations of successful achievement, not that it's in progress, still working towards entrustment, and at least from 2 assessors. So the Royal College has 4 assessment forms. Form 1 and Form 2 are by far the most common ones, and Form 1 looks at EPA observations, whereas Form 2 are specific for procedures like, for example, doing an epidural for labor analgesia. Form 3 we don't fill out for our own residents. It's multi-source feedback, so this is something that a surgeon or a nurse would complete on our anesthesia residents. And Form 4 are narrative observations. And I don't think that form is required mandatory for any of our specialties, EPAs. So we went over the EPA and Part A specifically. Now let's look at the milestones that are associated with EPA number 1 in transition discipline, Part A. So there are 15, and there are bolded milestones. So these are the only ones that you will need to assess a resident on. You'll see that they are coded according to stage, transition to discipline, and also CAN-MED competency, so medical expert, communicator, collaborator, scholar, etc. Now, these are generic milestones in the sense that this specific milestone can show up in another EPA. So don't be surprised if you see this exact same wording in another EPA. How do you assess the resident on these milestones? It's either not observed, in progress, or achieved. So, for example, elicits a history for a patient prior to their scheduled minor procedure, including but not limited to relevant past medical history, anesthetic history, and functional review of systems. Given that particular patient for that particular surgery, do you think the resident achieved the ability to do this? Yes or no? If it's no, then you would say it's in progress. And depending on your day, sometimes it's just not observed or it's not applicable. And that's it for Part A. So hopefully that explains the distinction between EPA milestones. Let's say it's now a new day and you're asked to assess Part B for that same milestone. So now this is your chart review. This is one type of indirect observation. Another one would be a case debrief discussing what happened afterwards with the resident. You're going to use Form 1 again, and you're going to collect the same information for the resident. Now they need 3 indirect observations and at least 2 assessors. Here are the milestones for Part B. They're slightly different. Some of them might be similar to Part A. It depends, because keep in mind, Part A was directly observing. Part B is now looking through their chart and what they documented. And you're going to use the same scales or points to assess them. Not observed, in progress, or achieved for each milestone. For sake of completion, here's Part C, but again, that's not relevant for us. So what do you actually need to document? And I know I'm sort of going a little bit beyond teasing the distinction between EPAs and milestones, but this is the next step. It's really 3 major things. Stepping back for this entire EPA, Part A or Part B, and this is pretty intuitive actually, thinking to yourself, can this resident do a preoperative assessment? And we're using an entrustment scale for this, which is based on the O score, or the Ottawa Surgical Competency Operating Room Evaluation. So when they're first learning, it makes sense. I had to do this for them. I had to talk them through this particular EPA. And with time, they should progress to, I needed to prompt, I needed to be there just in case, I didn't need to be there. And again, this is what you, on that particular day, felt how the resident's performance was for this EPA. And of course, with any judgment, there will be inter-rater variability. But if you feel that there was anything that was particularly outstanding for the day, very complex patient, chatty patient, not enough time, we were running late, then you could put that in the text box just to sort of qualify why, I had to talk them through, or I actually had to take over and do this. For the milestones, again, we already went through it. It's not observed, in progress, or achieved, and I've highlighted here in the document where the milestones are. And I sort of alluded to it, but there is a separate text box, and this is the third really important thing that you'll need to document and do, which is provide narrative feedback that's specific, timely, actionable. It's sort of like a debrief. Here's where you really step in as a coach for the resident and say, how do you think you did? This is what I think. How do you think you could do better next time? And that's essentially it. So hopefully this helped with teasing out the differences between EPAs and milestones. We just went through one pretty quickly, And I hope that this will help when you have to eventually kind of study and learn and become familiar with the next 86 of them.